Welcome all viewers to my YouTube channel. I am Sister Dr. Juliet Wangui Macharia, a gynecologist and a fertility educator and medical management doctor based currently in Voi, and I am working at Moi Referral Hospital, and you can also visit clinics at St. Joseph Shelter of Hope and at Savo Hospital. All are based in Voi. Today, it's a continuation of what we have been discussing for the past 2 sessions. And it's all about infertility. And as you continue watching, please don't forget to subscribe. I have so many viewers, and I wish to thank you for all who have viewed my YouTube channel, but remember to subscribe. Don't forget to subscribe, my dear ones. Let's continue with our today's session. We have already talked about hormonal infertility. And if you can recall, we said that most of women and even men who are suffering from infertility, some of them actually are not infertile. Something small which has not been well managed is making them, or it's making us to term them as infertile. So we have seen that women with abnormal hormones, or what we call hormonal imbalance, may be suffering from infertility, and yet they are not infertile. We just need to manage them properly, understand the underlying cause of the problem, and then we are able to help these women. So, no woman in this planet should die of infertility. Infertility is not a life sentence. It is manageable. So whoever is suffering from infertility, fertility education and medical management has a solution for all these women or all these men who are suffering. So don't die silently. Speak up. Come, do investigation, and we are here to help you. So remember, for all those who are suffering, and they are within Voi, some in Mombasa, some who have struggled for many years, call us 0725 25 2362. 0725 25 2362. We shall help you. And there is other contact 0700 234326. You reach me, I will direct you. What I can manage, I will manage. What I can, we can discuss and see the way forward. Please don't hesitate. Don't die silently. Come up, speak up, my dear people, and you'll be helped in one way or another. So today we want to talk about structural, one of the factors affecting infertility, and that's structural issues. So when you talk of structural issues, we are talking issues pertaining the uterus itself, the cervix, and even the vagina. So we have women who have suffered infertility because of what we call congenital malformation. This is the women who, for example, they have suffered because they were born with a small uterus. The uterus is not the way it's supposed to be. So that's a very small uterus. Or she has been born with some malformation at the cervix. We have women who have 2 cervix. Yeah, and most of these women, some may become pregnant, but they miscarried, and some may even become pregnant and they are able to give birth. And we have women who may not have the vagina. Yeah, the canalization was not well made. So this and many others is what we term them as congenital malformation. They were born with these issues. So this can lead this woman to become infertile, because the sperms are not able to pass through the vagina because the canalization of the vagina was not well done. Or the cervix and the uterus are not the way they are supposed to be. Structural, they are malformed. So in that way, she's not able to conceive. But we have women who have suffered from fibroids, and this has become a very common structural issue that is making women not conceive. But what I want to tell people is that not all fibroids can make a woman not to conceive. If the endometrium layer, the inner layer of the uterus is not affected, this woman can still conceive. We have many women who have conceived with the fibroids, and they even give birth with their fibroids. At the end of it, the fibroid, we may remove the fibroid later. Yeah? So, and you find that these fibroids are too big. Some wonder. They suffer, but they are able to conceive with fibroids. So, when one has a fibroid, it's not 100% that she cannot conceive. If the endometrium layer is not affected, if this fibroid is not so huge, that is, sometimes you find that it can even block the tubes, yeah? Or it can make it big such that the endometrium layer is there, it's not affected, but it has been squeezed in. So when it's too big, then you find that doctors will ask you to those fibroids to be removed. So you have to undergo what you call myomectomy, removal of those myomas, removal of the fibroids. So let it be understood, please, my people. We have women who have very small fibroids, 2 centimeters by 1 centimeter or 3 by 4. And then you find this woman has been asked to come for myomectomy. Really? Is it fair, surely? Is it fair for this woman to undergo that? If this fibroid is even outside, what we call subserous, it's even outside the uterus itself. It's just hanging. It's not even affecting the muscles. This woman is not symptomatic. Then you find somebody somewhere doing an operation for this woman. It's not fair. Let just be, let a spade be called a spade and not a big spoon, for sure. So if the fibroids are symptomatic, they have affected the endometrium. This woman is bleeding too much. This woman has got a lot of pains. This woman cannot get defecation, or she has constipation because the fibroids are actually pressurizing the colon, so that they are symptomatic. So in this case, we arrange this woman for myomectomy. That if they are asymptomatic and they are not within the endometrium, they are not affecting actually what we call intercavitary. Yeah, they are not within the cavity of the endometrium, the uterus itself. This woman can still conceive. So actually, that's why I tell people it is not actually the fibroid, this small fibroid, or it may be big, but it's not actually affecting the endometrium. That is not making this woman to conceive. So you have to do further investigations, look at the hormones, understand her menstrual cycle, and then come up with the conclusion of what your patient is suffering from. So this is the knowledge that we need to take. And this is what FEM says, that no woman, we should not pressurize women to undergo myomectomy. If the myomas are too small, they are asymptomatic. Yeah? So let us take these women for myomectomy if there is a need to do that. So that is one. So another thing is that women who suffer from infections, recurrent infections, yeah, and this can hit both sides, the male and the women. The other time people are asking, what are signs that a male have got infection? If you are married and your wife have recurrent infections, day in, she's given medication, she's not okay. After 1 week, the infection is back. You are supposed to be treated too, the man and the woman. It's a couple, not one person, because they are having sexual intercourse. And women, most of the time, when you have the infection, they are the one who suffer most than men. But you find that majority of men will not want to go to the hospital to be managed. So if your woman have recurrent infection, please make a point of being treated, both of you. It will help the woman and it will also help you too, because you are infected, but most of the time men are asymptomatic. So that is one. But two, when we have recurrent infections, and this infection will cause what you call vaginitis, inflammation of the vagina. It will cause what you call cervicitis, inflammation of the cervix. It will cause what we call endometritis, inflammation of the uterus. And then it goes to the tubes and cause what you call salpingitis, inflammation of the fallopian tubes. So once the fallopian tubes, these are very thin tubes. Once they are affected and we have the infection within the tubes, and this infection is not well managed, then because of the way they are being made, they are very thin. So they become inflamed, or you find that within the fallopian tubes, because of the infection, sometimes you may find some fluid within. We find fluid within the fallopian tubes, or you find the fallopian tube can have some kind of pus, and then they kind of now oppose, they come together. So if we are not aggressive in managing this infection, we end up having a blocked tube. So blocked tubes have become a big issue to majority of women as we are talking now. But one of the factors that is making women to have blocked tube is untreated or infections which are not well managed, that are making these women to suffer from this blocked tube, or even to suffer from what you call chronic pelvic inflammatory disease, the what you call as PID. It's very common, and majority of women are suffering from this. But knowing how to manage these recurrent infections is key. So it's upon us, we medical practitioners, to know how to manage. It's not just a matter of giving them pessaries, not a matter of just giving them the creams. Understand what organism, if a woman comes twice, make a good move of finding more about her, not just prescribing. Let's do high vaginal swab. Let us do calcium sensitivity to this woman. Let's follow them very closely, because we know if we don't manage them well, she may end up having a chronic problem, and that is blocked tubes, or chronic salpingitis, and many other, which can lead to her to suffer from infertility. So let us take this thing very seriously. Majority of women, as we are talking now, infection is taking place in them, and they don't understand whether they are suffering. Some have got whitish discharge, which has become very chronic. Some have got yellowish discharge. Some even green, which is foul smelling. In Swahili tunasema ina harufu mbaya. It pains your panty. The panty becomes yellow. Ukikaa unasikia harufu inatoka. Please make a point of visiting a medical practitioners. And if you don't have anyone, or you have suffered, then FEM has a solution of managing you. Call us, remember 0725 25 2362. And as you view me, please don't forget to subscribe. There's an option there, subscribe. You just have to bonyeza, and there you have subscribed to my YouTube channel. So apart from infection affecting women, so male, we have said that they are asymptomatic, most of them, but we need to manage them. So if a man has got a chronic infection, it may also affect the testicles. So once the testicles have been affected by the infection, you find that even the sperms, the storage, and all that can also be affected. So we need to manage both of them. And if a man comes to us, we also need to find out more about it. Does he feel pain during sexual intercourse? Does he feel pain after the sexual intercourse? Where is the pain? Does he feel even pain? Okay, sometimes if during micturition, when he's urinating, any pain, you have to find all that in the history taken. And you are able to pick some of these factors. Well, another factor is what you call endometriosis. Endometriosis is a big problem now. Majority of women are also suffering from this. But if we probe their history, if we probe the background of these women, you'll find that some of them used to have very heavy menstruation. Some of them, they used to have even very painful, and now they are even having even more painful menstruation. So when you talk of endometriosis, is when the inner layer, the endometrium, implants itself somewhere else. So if it implants itself within the muscles or somewhere else, it may lead to this. When these women present with very painful menstruation, very, very painful. Anaumwa sana wakati wa hedhi. Because the layer which has been implanted somewhere else, it is undergoing the normal changes that the other layer which has been planted within the uterus. So when it bleeds, the layer which is in another, has been implanted in another area, it is also bleeding. When during menstruation, there's this kind of contraction. The contraction is also taking place. So the pain is too much for these women. Some have undergone surgeries without success. So endometriosis, as it said, doctors are trying as much as they can to help these women. But sometimes they normally suffer a lot. And most of them have suffered from infertility because they are not able to conceive. But all in all, it can be managed. But sometimes these people have suffered for years, so the problem has become chronic. So even managing them, it becomes a problem. But it can be managed. So these are some of the structural factors that can affect women. Remember, if you have undergone surgery, this surgery can also make you not to be able to conceive. Because, for example, surgery was done for the removal of the myoma just next to the tube. And then when it healed, or when the scar healed, it affected part of the tube. So you can have a blocked tube, but not because of infection, but because of the surgery which was done. So sometimes, as much as the doctors try to save your tubes, sometimes it's difficult. We have women who have suffered infertility because of ectopic pregnancy. Ectopic pregnancy is a pregnancy that implants itself outside the uterus, within the uterine cavity. So it can implant itself within the tubes, it can implant itself at the ovary, at the cervix, outside, even in the abdomen, what you call abdominal pregnancy. But 70%, more than 70% of the pregnancy occurs within the tubes themselves. So what am I saying? When you have ectopic pregnancy on one side, most of the doctors will tend to remove what we call salpingectomy. We remove your fallopian tube. And if you are not well managed, and I repeat, if the problem which led you to get ectopic pregnancy is not addressed well, the other tube has a high risk of also being infected, and you suffer the same. So the moment we remove the two tubes, so the sperms are there, but they cannot reach the ovaries. You are ovulating, but the means of transport is not there. So you suffer infertility because of ectopic pregnancy, which occurred within your tubes. And because when one occurred, the other one was not well managed. That's why, as we teach you in this YouTube channel, any woman who suffered ectopic pregnancy and she has remained with one tube, this does not mean she cannot conceive. Even a normal woman whom you see, who are able to give birth to 3, 4, 5. She may be just using only one tube. However, having a one tube does not mean that you cannot conceive. What I'm saying, we need to investigate you properly. We need to manage you properly before now you try to conceive. So those within VOI who have suffered from this, don't just go and become pregnant. Because there's a high chance that what made the other tube to become, what made you to suffer from ectopic is still within you. So it can lead to other tube to be infected, and then we remove it. So before you plan for to conceive, make a point of going to the hospital. Make a point of visiting a gynecologist, and then she or he will help you on how to manage you properly before you conceive or you try to conceive. So another factor is that majority of women, as they suffer from infertility, there is what I've been discussing about, and that is male factor. A man with abnormal seminal analysis, the seminal analysis of his semen. So they may be in a little amount, that is, the volume might be lower than required. Another thing is that the sperms may be structural affected. They may not have tails or they may not have heads. Another is that the pH, you see the pH of the semen, for the sperms to move to the uterus all the way to the fallopian and then go to meet the ova and fertilization takes place. For that process to take place, we need what you call alkaline pH. So if the pH is not suitable for the sperms, or the pH of the sperms is not the normal one, then we may have these sperms dying and we don't have enough number of them reaching the ova to fertilize it. But it's not only the volume, because we have men who produce very little volume. So the concentration of the sperms also means a lot. So the analysis, when we check the analysis, we check the structural, the amount, the movement of the sperms. Remember what I discussed, that the sperms need to move forward. So we look how many sperms are able to move forward, the forward movement. So if your sperms have sluggish, they don't understand where they are moving, or they don't know actually where they are heading to, then there's a problem. So we need to know, why do you have abnormal seminal analysis? We'll check your hormones. We'll check your BMI. We will also check if you have some infection, just like a woman. We are going to check all these things. And that's why, as you suffer from infertility, it is not an individualized issue. It is a couple issue. Both of them need to be investigated, and then we are able to know where is the underlying, what is the root cause of the problem. And the moment you get the root cause, FEM has a way of managing the individual or both of you. And as we counsel you, as we educate you about your problem, we are also able to tell you what to do so that we can improve the condition that you are having, the problem that you are facing. We are able to manage you. So it's not only doctor's part. It's not only giving you medication. There is more than just giving you medication. We need to educate you. We need to counsel you. We need even to inform you more of what you are suffering. Because the moment you know what you are suffering from, the moment we know the root cause, then we are able to solve your problem. So, viewers, please don't forget to subscribe as we continue to learn more about infertility. So, I just want to give a summary of what we have been discussing about infertility. So we said it's a global problem. And we divided the factors affecting infertility into hormonal and structural. So hormones, FEM has a way of checking what you call basic hormonal profile, and we are able to come up with a way to manage this. We have our own ranges, and we are able to manage this. When you look at the structure, once we understand your problem, where is it fibroids? And if it's fibroids, are they symptomatic? If it's the blocked tubes, what's the way forward? Remember, women who are obese, a woman with a very high BMI may present with blocked tubes, but they are not blocked. The complication of obesity leads to inflammation of these tubes. So the moment the tubes are inflamed, and you check what you call the HCG, this is a way we investigate if the tubes are patterned. So if we find that they are blocked bilaterally, but the patient before us is obese, we manage the obesity first. And we have a number of women who presented to us with high BMI, some with bilateral tube blockage, others with only one tube blocked tube. We manage lifestyle changes, medication, counseling the patient, and after 3 months, 4 months, you repeat the HCG, you find that these tubes are patent. So let us not rush just to do the HCG and you tell you have blocked tubes. So FEM manages the patient first, unless after examining you, we are able to pick your problems, and we see that you may be having normal menstrual cycle. You have been infertile for quite a long time. You are not obese. You are within the BMI is good. Then in that case, we can check your HCG. But if you are obese, you have abnormal menstrual cycle, we manage you first before we rush to check the HCG. So that one, the medical practitioners need to understand. Don't just rush and give these results. Manage her first, especially those who are obese. Manage them first, and then you can check the HCG 3 to 4 months after. So that is what we are checking. Infections, we need to manage these women seriously. And both of them, not one. Both the couples need to be managed well. When we also checked about endometriosis, and we said it's a big problem. We need also to manage it. So we have a small number of women who suffer infertility, but they do not have hormonal issues. They do not have structural issues. They are very okay. The uterus is okay. The semi-analysis of the husband is fine. Her hormones are okay. The ovaries are normal, but she can't conceive. So these are women, we teach them to understand their menstrual cycle well, and they are able to pick the days that they are really fertile. So FEM will teach women to understand the time she is really ovulating. And we ask them even to buy the LH strips, so that after understanding their fertility window, we are able to pick when she's about to conceive. So we tell them to use the LH strips, and once the LH turns positive, then we know within that 6 hours this woman might be ovulating. So we journey with these women, and you find them, majority of them, actually the problem they have is they don't understand their menstrual cycle. So they don't know the timing. So remember, we have different women. You have women who are fertile just for 24 hours. Some are fertile for 48 hours. Some are fertile for even 72 hours. So where do you belong? So unless we teach you, then you are able to understand yourself. So menstrual cycle is a day in, day out. That's my slogan. And any woman who does not ovulate is not normal. So are you ovulating? Do you have these factors that I've talked about? Do you have an hormonal issues? I talked about the skin changes. What is your BMI? Do you have the myomas? Do you have recurrent infections? Is your husband okay? Has he checked the sperms? So with all these things, after understanding even more than this, because some of them we pick them as we examine you, then we come with your underlying cause. And then that's why we say FEM has got a solution. After understanding your problem, we are able to manage you without problem. Then we encourage you to adhere to the drugs. The lifestyle changes is key, especially those who are suffering from obesity. Yeah, follow up. When the doctor tells you, come after we do this investigation, come. Checking the hormone at their very specific day. Not just checking the hormones, but what hormone are you checking at a particular day of the cycle? So we doctors, we have to understand the menstrual cycle. So women suffering from infertility, understanding the science behind the menstrual cycle and the cycle of your patient will help you to understand more of the condition she's suffering from. So let us learn more. Follow me in my YouTube channel and we learn more about this. Those who are suffering from infertility, FEM has a solution for you. Don't suffer, don't die silently. Subscribe to my YouTube channel, follow me and learn more, and do not hesitate to call us 0725 25 2362 or 0700 23 4326. Just call me, I will inform you. Those who are within Voi, Taita Taveta County, you can find me at Moi Hospital, or you can find me at St. Joseph Clinic, Town Clinic, or Shelter of Hope at Ikanga or Savo Hospital. So those who are within Taita Taveta County can reach me from there. And those who are in Mombasa can also call me, and then we can plan to meet at Mother Madea Hospital. That is our hospital at Mikindani, Mombasa. And then we are able to start the journey. It's actually a very beautiful journey when you start to understand actually what you're suffering from. So don't forget to subscribe and continue learning more in my YouTube channel. Let us understand our bodies. Let us be the masters of our own bodies. Let us become doctors of our own bodies. And we are able to pick any pathology which comes across. Those suffering from infertility is not a death sentence. Please don't forget to subscribe and follow me to learn more about this. Thank you so much. God bless you, my people. I love you all. And please don't forget to subscribe and continue tuning in my YouTube channel, Sister Dr. Juliet Macharia. Thank you.